So now I'd like to introduce Katha Fortier, who's the National Director of Healthcare for the Canadian Auto Workers Union. The CAW represents over 20,000 healthcare workers in the province of Ontario in a variety of workplaces, including acute and chronic care, public hospitals, homes for the aged, nursing homes, and retirement homes, as well as ambulance services and other community-based health and social services agencies. Katha has also worked in a small rural hospital for 20 years. So please join me in welcoming Katha. Thank you.
Oh, thank you. And my comments are very informal today, but I do know that many of you probably don't think of the Canadian Auto Workers Union as a healthcare union, but we actually are. We have probably about 27,000 healthcare workers across the country. But what I do hope you know about the Canadian Auto Workers Union is that we're a social union. And we're very concerned philosophically, and whether you're out of an auto parts plant or another sector, that they have always had a very good social conscience and have always recognized the importance of public services, and particularly healthcare, and preserving and enhancing the Canada Health Act. So again, just want to make that connection to people. I do want people to know as well that our union has always made the connection about improving working conditions for healthcare workers, and that will directly improve the lives of those that they care for, and that there is a correlation there today. And I think Tamara said earlier, she put it out in talking about long-term care. Conditions of work are conditions of care. They go hand in hand, and there is absolutely no difference between the two. One affects the other, and they rely on each other. We also, interesting things some people talked about this morning was the lack of value that we have on care work. And it's not a coincidence that women are mostly providing this care work. And I think we will see some interesting changes. I think that in the next few years, particularly, we've seen a number of manufacturing jobs go out the door. And we'll see more men coming into this profession, into nursing, personal care workers, support workers, and all sorts of work in long-term care and healthcare. So it'll be interesting to see the change and the effect that has on our industries. People also talked this morning about teamwork and the need to value everybody's contribution, and to that every healthcare worker has the ability to heal or harm. And I think that's so critical. People walk into we often want to think of the doctors and the nurses as being healthcare, but and of course the nurses will always recognize it, as do the doctors, that it's an entire team of workers, and the value of the lab technologist that analyzes your blood sample to the housekeeper who prevents the spread of infection is absolutely critical to a well-running, well-functioning healthcare. And it's important that we make sure that people are doing the jobs they should be doing in healthcare. And when they cut back on things like security, or they cut back on housekeeping, that just makes everybody else's job worse, and it is a terrible situation for people. But the reality is that we look at healthcare, and we talked about hospitals this morning, and nursing homes and home care, and we're not going to find a one-size-fits-all solution for everything. Everybody's a little bit unique. Obviously, with the hospitals, we know they're covered under the Canada Health Act, but they also take up the biggest amount of the healthcare spending. And right now, we're in the middle of a recession, and the GDP has gone down because we've lost so many other jobs. So what happens when the GDP goes down is, of course, it looks like the percentage of healthcare spending is going up. And it's a game. They want to convince us that we're spending too much money on healthcare, but quite frankly, that the healthcare spending has really remained relatively stable over the last 20 years. We're at about 10% of GDP. And that's, obviously, if there's a recession, it goes up a little higher. If times are good and the economics are good, then it's a little bit lower. It just really depends on what our GDP output is, more so than what we're actually spending. But the reality is that hospital care has actually gone down, and hospital care over the last 20 years or so, we're actually spending about a percentage less of GDP, but the pharmaceuticals, unfortunately, have taken up that extra percent that the hospitals aren't using anymore. So again, we certainly have a big picture to look at when we look at healthcare funding and how we fund our hospitals. When we're in a recession, they want to cut the hospitals, and that's what we see right now. I'm out of Windsor. That's where my job is located, and last year near the end of the year, last September, I believe, they cut 20 beds out of the Leamington Hospital. It's a small community hospital. They had about 82 beds, so it was about 25% of their beds, and there were a number of nurses laid off. And last week, somebody just called our office and said, well, there's not enough beds. They want to open 10 interim beds in the Leamington Hospital. So after we've gone through and spent all this money on restructuring, on packages for people to leave early, because obviously, most unions would have packages negotiated so that instead of layoffs, older nurses, more experienced nurses are the ones that are leaving with early retirement packages. We've lost all of those experienced nurses out of the system, and yet we're going to open up now more beds. Where is the efficiency? Where is the thought process? And the other part, of course, is that as we're in a recession, anybody who works in healthcare will know that we need our healthcare services more than ever. I mean, depression, family violence, there's all sorts of issues that people need to rely directly on hospitals, on their healthcare system, as well as people are losing their benefit plans. They can't afford their medications. They can't afford their high blood pressure medications. They're getting sicker, and right into the hospital they go and into our emergency rooms. So instead of taking money out of our hospitals, we need to be able to stand up to our government and tell them that they have to fund our hospitals properly. Nursing homes, as Linda alluded to, long-term care really is our shame. But the reality is that most Canadians don't know that long-term care isn't part of the Canada Health Act. They don't understand it. If they spend any time in a nursing home, they absolutely know. They all support better care, more workers in there. It makes sense. But most of us aren't affected directly by a nursing home, right? I mean, probably more than half of us in this room have an immediate family member in the school system somewhere, but probably only about 10% of us have an immediate family member living in a long-term care facility. So again, we can sort of put that in the shelf and on the back burner. Nursing homes, and we did talk about this morning. Tamara touched on this, and there is no measurable standard of care for our nursing homes. In Ontario, we're almost the highest at for-profit operators running our nursing homes. The not-for-profit groups like hospitals, municipalities, and charitable organizations that run nursing homes can't afford to do it anymore. They're getting out of the business, and it's being taken over by for-profit agencies. And yet, these corporations, we fund them, we give them money, we give them billions of dollars every year to operate our nursing homes, but we don't hold them accountable to provide any specific level of nursing and personal care. It's absolutely shameful that we're handing over this money with no consequence. It's regulated. We have lots of rules, and a compliance officer can go into a nursing home and she can ask the nurses, are there enough people here giving care today? And if that nurse says no, there's absolutely nothing she can do about it. If they're working short-staffed, there's absolutely nothing that they can do about it, and it does make absolutely no sense. One other aspect of long-term care that we didn't really talk about today is retirement homes. And if you would see them, you would know them by their advertisements. Look in your newspapers, listen to the radios. It's a competitive industry. And anybody at this point in time can actually just hang up a shingle and they're all of a sudden a retirement home. Their only governing law at this point in time is the Landlord and Tenants Act, and they're absolutely unregulated. And the care that is being delivered there is unbelievable. I mean, normally a retirement home would be sort of people who are mobile, people who need very little nursing and personal care, but yet you go into a retirement home today and they're using mechanical lifts. Residents that live there need help to be fed with all of their aspects of daily living, and it's certainly not what it's intended to be, but it is a way for for-profits to make an incredible amount of money. And then, of course, we talked about home care. And I love the word managed competition because, again, back in the day when VON and Red Cross and all of these other not-for-profit agencies ran our long-term, or our home care industry and did the services, it was really a respected profession. People stayed in home care nursing or home care personal support. They loved it. They did it for years and years and years. Most of them were organized and had decent conditions of work and benefits. But then they brought in this managed competition. And I don't know if people understand completely what that means, but now all of a sudden the ComCares and all of the other for-profit agencies can now bid on this work. They've shut down many of the not-for-profit agencies across the province. And the reality is when those not-for-profits shut down, and a new contractor, a for-profit operator, gets that work, they don't even have to employ any of those people who worked for VON or Red Cross or any of those other agencies. They could be completely without a job, no job security, and certainly a collective agreement that wouldn't follow them with the new home care provider. So it's really set up a system of chaos. People who were in long-term home care for many, many years have just left because of the insecurity, and they've just left, and the turnover rate in some home care agencies is as high as 100% every year. Again, we look at more and more precarious work, part-time work. Our healthcare workers in every classification are working more than one job. In almost all cases, when they're coming into the workplace, they're stressed, and we wonder, nobody's doing any studies on the costs of all those people that are working from one institution to another, and we look at all of the influenza and H1N1 and that goes around, and we see nursing homes and hospital wings shut down because of this, and yet we know there's those healthcare workers going from one agency to the next to work because they certainly need the jobs. So certainly makes no sense, and we do know that there are a lot of problems. But there are some solutions as well, and they aren't easy solutions, unfortunately, but we do work on them. We try to build on respectful work environments, and for our union, for the CAW, we try to incorporate bullying and harassment language into all of our collective agreements, and we try to actually bargain things with the employer, as well as we want to offer our leadership people some training on those issues as well. And we actually do have bullying and harassment programs that we can bring into the workplace and do on certain areas. We've done them in nursing homes and other areas, because the reality is that the bullies have been created by their environment, absolutely. It's easy to attack each other. It's easy to attack and say somebody isn't pulling their load, or, because you know what, there are no supervisors, and quite frankly, it's not that easy to stand up to the boss. So we do try to give people some tools to be able to deal with that issue.